This video will describe the Anesthesia Museum at Robert Jones University Hospital and some of the items that are contained within it. There's a web page to access the museum as well if you want to visit his electronic web page. There are 3 different locations with all the anesthesia elements are. This first room is a little bit messy. It contains several anesthesia machines. You have a Ohio machine with a Vernitol vaporizer, and on top of that there is a collection of different photographs, all original, primarily focused on anesthesia. This is Kimberly Ann, and then here we have Dr. Michael DeBakey, another Mr. Barney Clark, who in 1983 had a mechanical device inserted. Again, Dr. Michael DeBakey examining one of his patients. There are several pictures, different cardiac surgeons, Dr. Cooley, and Miss Kimberly Ann was actually an example of how making a mistake in anesthesia patient can die. There were 3 deaths that occurred on her case in 1965. You have a suction with these Yankauer cannulas. Then we have another Ohio machine with an isoflurane vaporizer connected to it and a hanging bellows. You can see other Ohio V5A hanging bellows ventilators there as well. And here we have a McKesson graph machine, just without any standing hole on it. Here we have another McKesson machine in the back, and in the front we have a Ford military issue anesthesia machine that was complete in its box when I purchased it. Most of the items in the museum have been collected personally, although I have several colleagues contribute with very nice pieces, and all their names are due credit in the webpage. You have here a Draeger narcomed anesthesia machine, and McKesson with a nasal mask used by dentists. You can see the nasal mask for which the agents were administered to the patients. Here we have another Ohio machine with 2 Vernitol vaporizers, and it's a ventilator as well, a hanging bellows ventilator. As we exit this room, we get to the room contiguous to it, and here we have many items. You see glide scope, black and white, a suction machine, sphygmomanometer with a mercury column. We have a first ultrasound machine that we had in the hospital, actually with a mechanical probe. Very small screen, very poor imaging compared to current standards. This is a 1918 Hidbrink anesthesia machine. As you can see, there are many items in this room, books, publications, all pertaining to anesthesia, some also pertaining to cardiac surgery, although we have a separate display of cardiac surgery mechanical devices. Here we have another anesthesia machine, isoflurane vaporizer, and we have a FOT sphygmomanometer, it's 1918, and a Pacton sphygmomanometer in 1930s, different videolaryngoscopes, and a collection of stereoscopic views of primarily the Boston Ether Monument. Other boxes, wooden boxes containing different surgical tools. Monitor, a gas analyzer. It's no longer in use, although still usable. In Abumed, we have Dr. Apgar's image. We have also only 2 anesthesiologists who have stamps, and then Dr. Apgar in the bottom, and Dr. Crawford along at the top. We have different items for teaching. Here we have a casing miter resuscitator, World War II, different ambu bags, microscopes. Again, Dr. DeBakey and his DeBakey bifurcated aortic biphasic graft. Again, items and teachings, tape recorders, slide presenters, infuser, pressure bag. Here we have different syringes, tube adapters, vaporizers on the bottom, another monitor, and all these vaporizers. You see temperature probes, different sphygmomanometers, especially this was used for air clinician in California. And here we have 2 O'Dwyer intubation sets, ideal when they had typhoid fever, actually, to intubate the larynx. Additional images, tubes, fluid tank vaporizers, and an original fluid tank vaporizer repair kit in this box. These are all, again, items, different angiocats, IV catheters, ether vaporizer. Here we have an Emotril automatic trichloroethylene inhaler from 1950s, different masks. And the bottom there, you have an Ermo inhaler, 2 of them actually, and then a number 60 Ohio Hydrant Infant Circle System absorber. Pediatric masks, 304 twitch, neuromuscular blocker twitch. Here we have a Dakota MK6 trichloroethylene inhaler, 1955. Again, military intubation set by Forder in circa 1962. Other vaporizers. Here we have a Porton resuscitator, 1951, 1969, circa. Different pediatric masks, inhaler for obstetric analgesia, different medications, ether containers, propofol, thiopental ampules, the tubocurarine. Here we have also a other inhaler, Ombridan inhaler, esophageal airway. Have different laryngoscopes, Chevalier-Jackson laryngoscope at the back. Different laryngoscopes, tracheostomy access, a new trach, tracheostomy tube, cricothyroidotomy kit, and then different intubation devices. We have different intubations, including the wooscope here in the bottom, as you can see, monitors, and different books, anesthesia related. Here we have, again, different angiocats. We have a Gilt Hamilton Bailey's intravenous catheter as gold-plated. It's one of the first IV catheters or cannulas used for that purpose. Different ether, chloroform, inhale agents, chloroethylene. Here we have a Chirana medical anesthesia pump, 1964. It's used ether and or trilene, had 2 vaporizers in it. And here is a Junkers inhaler, circa 1867, 1890. As you can see, many devices in the museum. This is just to as a glimpse of what is contained in the museum. And then different, medical. This is a Chirana box where that anesthesia pump was housed. Different ads, and one of the first descriptions in the newspaper also of the discovery of ether by Dr. Morton. Published there. And then different other, ads in the newspaper. As we exit this room, we'll go into the hallway that communicates the hospital building with this building, which is an academic building. And there we have additional items. But as we exit the anesthesia department, within the entrance of the anesthesia department, we have additional devices, inhale agents, obstetric analgesia, different oral airways, We have different photographs of the time, how medical care was given. We have a Bird Mark 7 ventilator. We have this Belize Universal Anesthetic Vaporizer called the Univape 1960. And we have an Ohio number 8 and a Copper Kettle Vaporizer 1952. And the Ohio, the brown one, is 1930s. So this is the entrance of the anesthesia department. Here different medals, mostly commemorating Dr. Morton's discovery of anesthesia. Some of Dr. Crawford Long as well. A plate of Dr. Crawford Long's office in Georgia. And here different syringes. Two magnetic ventilators, a Kaoka ventilator. It can actually circle by pressure, cycle by pressure. Another ether inhaler. And then we have a Beaver respirator, 1953. So all the shown so far is contained in the anesthesia department. Now this is the display between the hospital and the academic building. So you can see we have two anesthesia machines and multiple items contained. At the top we have a collection of different photographs on how the operating rooms looked current time, and going back to a picture from 1910 showing how the operating rooms look at that time, personnel working within it. Here we have a Sheldon tracheostomy kit, the first tracheostomy kit, percutaneous tracheostomy kit invented 1957. And here we have Dr. Takaoka, Dr. Baraka, and we have different sphygmomanometers, laryngoscopes, Jackson laryngoscope, additional blades. This is a reproduction of the picture of Dr. Crawford Long. One of them is actually Dr. Long, the other was his brother, the other was an identified person. I'm not sure who is who in the picture. No one actually knows. Self-inflating bag, different intubation tubes, first heart transplant patient in the back, another military issue intubation set, monitor, cardioscope as intubation set, military, Dr. Forrest picture on the top. And we have a syringe pump and another ventilator, anesthesia ventilator. Here we have a machine that has two copper kettle vaporizers, and another machine with and this is Dr. John Glenn, the discoverer of the anesthetic properties of propofol, different anesthetic agents, and vials containing Dr. Morton and Dr. Crawford Long. Dr. Crawford Long, that's Dr. Morton, and here's Dr. Crawford Long. His daughter wrote a book about his life, amazing reading. Here, how surgery used to be done in the past, and different masks, and vaporizers, and inhalers, and pediatric anesthesia masks, and pictures representing our work. Again, different vaporizers. We have a hidden vaporizer, ether containers, a boil bottle, Dr. Ombridan in his inhaler, and then the Camus inhaler, and so many different items. I can spend hours describing all of them and talking about it. Here's how everything started, when really no good analgesia provided to our patients, and it's a picture done by Thomas Rawlinson in 1785. It's called The Amputation. I hope this brief view through the Anesthesia Museum sparks your interest and curiosity to visit us in person or just through our webpage. I hope you enjoy.